Hello everyone, and welcome to another episode of Rants and Yarn with Two Best Friends. And Stefanie's again busy, so I'll be doing a video by myself today. And last week I made you guys a video before I went on vacation, and I just wanted to talk to you a little bit about my vacation. And if you guys, whoever of you has Instagram or Facebook, you'll be able to see the photos I took of my vacation. I didn't take that many, I just took a few, and I just took a few, and yeah, I just took a few of some of the places and things that we did, when I did the mud bath with my husband in Calistoga, when we went up to when we hiked and saw the lava ash and some interesting trees at the petrified forest, and we went to Grass Valley and we saw the old mining town. I took some pictures of that. And we went to Nevada City, and I took pictures of a tulip garden that we visited. I think the tulip garden was in Grass Valley as well. I'm not sure if it was Nevada. I think it was Nevada City, yeah. And what I didn't take a picture of, I'm sorry to say, but it was of the abandoned Nevada City hospital. It was hospital and psychiatric ward, and it is and you guys can Google it and see people who have watch videos of people who have who have gone in and walked around the inside of the place. I mean, it's not like really open for people to just walk in and see the place. It's just like for people who just want to, for people who want to go in and who see an opening and just go in to explore the place. Uninvited, obviously. But it wouldn't be such a big deal if people didn't leave graffiti. Yeah, if people didn't leave graffiti on the property, or took things or did things, then it wouldn't be such a big deal for people going in just to look at the place. But I mean, if you don't want an abandoned place, if somebody else took ownership of it, just haven't done anything with it, I mean, if you don't want anyone to vandalize the place, there probably still will, but I mean, for the curious people, just show them pictures, do a video, and show them what the inside looks like the person who now owns the place, and then they will just know what it looks like, and they won't be curious anymore, because they'll have seen pictures and be like, okay. Because when I watch videos of people who there are these YouTubers who go in and specifically they visit abandoned buildings and take video of it, of their exploration, and it's really cool. There's different people on YouTube that actually do it, but I watched the group called The Proper People, and I just stuck with them, and they're the cool people who do this, and they went there and did a video on that place, and it was cool, and they showed around the inside. And the reason why that specific place is closed down is because it was it was in 2000. Specifically, why that place was closed was because in 2001 there was a shooting that happened on site, where this guy was unhappy with his treatment and wanted to speak with his doctor, but I guess his doctor wasn't available, and he happened to have a gun with him and shot the receptionist and 2 other people working there, and then he was deranged, and he thought that the place where he would go and eat at regularly, that they were poisoning him, so he went there and shot up 2 people, and eventually he was caught, and he's been in jail he's gonna be in jail forever, till the day he dies. I don't know if he's in the psychiatric part of the jail, or, even when you psychiatric part of the jail or what, but I mean, and this place was also used to treat inmates for psychiatric situations, because, and some jails don't have enough place to house people like that, and they need the proper treatment, whether or not they get released from jail or not. These people still deserve proper treatment, even if they're going to live their whole life in a psychiatric ward. And it's sad, because some people actually do. And the other half of it was used as a regular hospital to treat patients, It was Nevada County Hospital. Now, that place has just been abandoned, and there's so many other abandoned places. Quite a few of them that the proper people have visited have been destroyed, and taken down, and who knows what's put in its place. But I mean, for the meantime, they tear down the place, like in Japan, like the Disneyland, like the theme park that was a knockoff of Disney that they built in Japan. It was abandoned because there wasn't enough people. The attendance went down, and they abandoned it, and eventually, 2 years ago, it got tore down. So it takes time for places to find new purpose for it, or just to tear it down, because sometimes it just costs too much to restore it back to its former glory and try to make money off of it. Other times the money's there, it's just not feasible to do certain restorations, like old abandoned hotels. I mean, it would be nice to restore them, but when several attempts fail, it just ends up sitting there for a while until someone decides to tear it down and do something else with the land. Or those buildings and hospitals and places, they just remain there forever, and that is that. They just remain there forever, and that is that, and nothing ever happens to them. But luckily, the Ag News Developmental Center here in San Jose was a mental hospital and hospital facility of other things too. And then finally, they're going to, I guess, tear it down and build something in its place, some schools or other things, And some hospitals, they get repurposed for, some other hospitals, they get repurposed for, like urgent cares and just private offices for doctors. Because sometimes it's just too much to just restore it back into the natural hospital that it was. with the emergency room and inpatient housing and all that stuff. There's so many reasons why that's not feasible, but people grumble about it. Why was this facility not restored and a new one built, you know? It's just like a whole lot that goes into the whys and why nots, and it's just hard for people to really get a clear answer, because the people who make these decisions don't really give out just a simple answer, you know, as to why, you know. So yeah, it's just cool to see. That's just like the part of history that, and it's just cool, because I mean, you want to preserve history, but sometimes it may not be a good idea, so you just repurpose things and find different uses for them, or just leave them there as part of history. Like the Ellis Island Hospital, they just reopened it recently for people to just visit the hospital. They're not really doing anything else with it, because Ellis Island is just for visiting now. It's not really used for anything much anymore these days. So it's a whole island just for tourists to visit. And the old mining town is cool, where the Bourne family was the one that started the whole mining for gold, and of course the 49ers, they came in, and everybody was coming out to California to mine for gold, but it was to pan for gold. It was the Bourne family who started the whole gold mines and going in there and doing it. And after that, they moved to the house I visited here in Filali, and they're best known for the Filali Gardens. And they came here, and he started the water company, which we all know now as PG&E. And there's something else that connects them to Southern California, to Pasadena, but I have yet to go down there and explore. And once I find out, I'll let you all guys know. And just nice places to hike up there, and nice wineries to go wine tasting. We did do one and bought some wine. And it was just a fun vacation to see some history and do some hiking in California, you know. There's a lot to see in California where I'm from, and you know, yet to be seen all the other places to visit. Like, I've been to Florida, but I went for the whole Orlando, Buena Vista, you know, Lake Buena Vista, the parks, you know, all that there. But then we went to Daytona, and that was last month. And there's always a lot to see, you know, a lot to see and do in all different countries, all different states. But when you have to like stay home and not fly out, you find fun things to do within your country and within your state, and visit all the museums and rich things. It's just a drive up and down California state, so you make a lovely trip out of it. And for me, it's fun. So I will fill you in on the next adventure when we have another one. So the article I have for you today is called "This is what it's like waking up during surgery." Because people would think that during surgery you'd be asleep for the whole time, and the moment you wake up, it would be in your hospital room recovering, whether it's a shared hospital room or whether it's one that you have by yourself, which is private. And that's where you think you'd fully wake up, and you don't think of ever waking up while in surgery. I mean, I'm not saying like fully awake where your eyes are open and the doctor notices that, or the nurse that's watching over you, like who's above your head, if they're doing surgery in the lower parts and there's someone who's watching you above your head, you know, to make sure that, I guess they're there to make sure you're fully asleep, or, you know, everything's going well on the top half of you. But so the nurse would know if you woke up. But sometimes I guess you're like kind of awake but like asleep. It's hard to explain. It's that state of being where you can't really open your eyes because you're out, but then you're awake, like, oh, I can like hear what's going on, you know. That's why some people say that they hear what's going on or being talked about in the hospital, but it's like talked while they're having surgery. And it's like, but then when you hear something that you don't want to hear, it's like, it's hard for you to just say, well, I was awake and I heard that, because the doctor's like, no, your eyes were closed and you were supposed to be you know, and they don't believe it. But some people do, and then it gets dicey from there. General anesthetic is supposed to make surgery painless, but now there's evidence that 1 person in 20 may be awake when doctors think they're under. So, as I was saying, pardon me. So, as I was saying, yeah, doctors think you're under because, like, your eyes are closed. They're not, like, open. But even if your eyes are open, they're still going to assume that, I don't know if you open your eyes, they'll assume that you're awake and try to put you under again or do something or stop the surgery. I don't know what they would do if they like saw you like literally awake, because they'd be like, is she really awake and saying something, or is she like asleep or in a state of, in a alternate state and talking, you know? So it's hard to gauge, but if you know for yourself that you're awake, for me, I think that's just scary. But the anesthesia didn't keep you awake, didn't keep you fully asleep until like you left the surgery room. It can be the smallest event that triggers Donna Penner's traumatic memories of an operation from more than 10 years ago. Of course it would be traumatic for her. I think I would be traumatized, or anyone else would be, if they woke up while in surgery, you know? Because that's not something that you want to have happen. Because you already know what surgery you're going in for, but you don't want to wake up while in it, or anything to that effect. One day, for instance, she was waiting in the car as her daughter ran an errand, and realized that she was trapped inside. What might once have been a frustrating inconvenience sent her into a panic attack. Started screaming. I was flailing my arms. I was crying, she says. It just left me shaken. And of course, because maybe the door got locked, maybe she still had her keys, but something triggered her. Or maybe her daughter took the keys and locked her in the car, for instance, but the window was cracked open, who knows. But in any way, that shouldn't faze people, but it fazed her. Like, she could have just like opened the door and let the alarm blare, like I've done before when I was a kid, and it wouldn't matter. But you know, trauma. Even the wrong clothing can make her anxiety worse. Anything that's tight around my neck is out of the question. Because it makes me feel like I'm suffocating, says Donna, 55-year-old from Altona in Manitoba, Canada. Yeah, so you don't want to wear anything that's constraining you if you get panics from it. And that's sad because most of those tight things keep you warm when it's cold, you know, like turtlenecks and stuff. Donna would not be like this if it were not for a small medical procedure that she had before her 45th birthday. She was working in the accountancy department of a local trucking company and had just celebrated the wedding of one of her daughters, but she had been having severe bleeding and pain during her period, and her family physician had suggested that they investigate the cause with exploratory surgery. So it's sort of kind of like the same gist as I don't know if you're awake during colonoscopy, but I think for some procedures where they have to just see what's going on inside you, they put you to sleep and they put instruments in there to check what's going on in your body, because sometimes they just can't do it the normal way. Understandable, you know? So they put you to sleep, they inspect what's going on up there, then they wake you up again, and then once you're non-drowsy anymore and you're in your normal state, they explain to you what they found, etc. But yeah, it's a thing. It's a thing when they have to it should have been a routine procedure, but for reasons that are far from unclear, the general anesthetic failed. Rather than lying in peaceful oblivion, she woke up just before the surgeon made the first cut into her abdomen. With her body still paralyzed by the anesthetic drugs, she was unable to signal that anything was wrong. It's so sad because you wake up and I guess there was nobody up there to see that she was awake, and they were down there helping. I mean, she wasn't even in the middle of surgery yet. It was just the beginning, and she woke up, but she was all numb everywhere else, so she couldn't feel the pain. So she couldn't move something and say, "Hey, I'm awake. Don't start yet," you know? And that is frightening. That is frightening. So you feel like, "But awake, no!" You know? No. So she remained frozen and helpless on the operating table as the surgeon probed her body. While she experienced indescribable agony, I thought, this is it. This is how I'm going to die. Right here on the table, and my family will never know what my last few words were like, because no one's even noticing what's going on. Yeah, because nobody checked her. And they were just doing their job, and I mean, maybe she couldn't feel what they were doing, but you know, mentally, physically, she knew what was happening, and it was scaring her, of course, because you don't want to be awake for these things. You know what they're going to do, but you don't want to be awake for these things. You just want to be asleep and then wake up and then find the results out, you know. The lingering trauma can resurface with the slightest trigger, and still causes her to have 2 or 3 nightmares each night. Having been put on medical leave from her job, she has lost her independence. She suspects that she will never fully escape the effects of that day more than a decade ago. It's a life sentence. And it's not just that causes people certain life sentences. There's a lot of triggers for people if trauma happens in their life, and it's sad because they can't live a fully independent life anymore, and it sucks. For years, anesthesia awareness has been shrouded in mystery. Although extreme experiences like Donna's are rare, there is new evidence that around 5% of people may wake up on the operating table, and possibly many more. Well, there's only the 5% that have been documented, but that's scary! I have to get a procedure done myself in the future, and I don't want to wake up while it's happening. I don't want to eat. I don't care how quick or how long it takes. I just don't want to wake up for any part of it. I want the anesthesia to like fully work, you know, and it's sad for those 5% that have to deal with it not fully working for them. Thanks to the amnesiac effects of the drugs, however, Most of these people will be unable to remember anything about the event. Whether or not that is something we should be concerned about is both a practical and a philosophical question. So they're going to be fully awake for it, but they're not going to remember they're not going to remember the procedure and what was done to them and the feelings and everything, but I guess they're remembering the fact that they woke up and they knew that they were in surgery. I guess that's the trauma right there. These results are all the more significant given just how often general anesthesia is now used. Almost 3 million general anesthetics happen each year in the UK alone, said Peter Odor, a registrar at St. George's Hospital in London. As a consequence, it's more probable than not that someone somewhere in the world right now is the wearer during their surgery. Oh boy. Oh boy. That's scary to even say, you know? We once knew surprisingly little about any anesthesia works. Now, however, researchers are striving to understand more about the nature of going under and the circumstances in which anesthesia doesn't work, in the hope of making advances that might reduce the risk of anesthesia awareness and with a greater understanding of the anesthetized state. We may even be able to turn a rudimentary awareness to our advantage in front of medical hypnosis. How doctors tell if you wake up during surgery. Researchers are only just beginning to really understand anesthesia awareness. Let's be clear, anesthesia is a medical miracle. Since at least the time of Hippocrates, physicians and medicine men had hunted for a good way to ease the pain of medical procedures. While drugs such as alcohol, opium, and even hemlock could act as sedatives, their efficiency is unreliable. Most patients did not escape the torture. Of course, because like back in the day, they used alcohol, they used a lot of things, but you were still awake for the procedure. And that was the scary part, because you could like see what was going on. It was like, ah, because like you incapacitate yourself from the drugs, from the anesthesia, from the alcohol, and then it numbs your whole body, because some people, you know, and then you just wake up and you don't really realize you were super inebriated. You don't realize what has happened to you, but at the moment when you're seeing it, you won't probably remember the next day, but probably at that moment in time, you'll see what's happening, and oh, unpleasant. By the 1840s, scientists had discovered various gases that appeared to have sedative effects. One of these, sulfuric ether, had attracted the particular attention of a dentist based in Boston named William Morton, who put it to the test in a public demonstration at the Massachusetts General Hospital in 1846. Although the patient was still able to mutter half-coherent thoughts, he reportedly felt no pain, just a faint sense of his skin being scratched with a hoe. Okay, I don't like that either. I don't like feeling anything. I don't want to feel anything, period. But, you know, at least you're looping. You won't remember what happened the next day. But, you know, you're still coherent. Like that one episode of Sister Sister where the mother, I forgot which sister's mother it was. But the mother, she had to undergo some dental work, and you could see her like under the gas, but still being coherent, but then being like woozy after the fact. I don't know if she had to, I don't remember if she had to undergo like emergency surgery for her at the dentist, because she had to go to a funeral after that and say something, and she was all loopy and it didn't go so well. The news of the demonstration soon spread throughout the medical establishment, heralding the state of the anesthetic era, with the subsequent discovery of even more effective anesthetic agents such as chloroform. The agony of the surgical knife seemed to be a thing of the past. Yeah, because now when you're able to like be numb, oh, it doesn't hurt anymore if you have to get your tooth pulled. Oh, it doesn't hurt anymore if you have to get whatever other dental work or whatever other work procedures. Because back in the day, oh crap, you have to get your teeth pulled. Just drink alcohol until you can feel no more and then go. But if you have something you can take that's fast, very good, very well. Today, anesthesia has a wide range of pain-killing and consciousness-reducing drugs at their disposal. And the exact choice will depend on the procedure and the patient's particular needs. And of course, the anesthesiologist is supposed to be there to assess the patient and know what will work and what's going to be used and what can't be used, based on each individual patient. Often, the aim is not to produce a loss of consciousness, but simply to remove the sensation from a particular part of the body. So-called regional anesthetics include spinal and epidural anesthetics, both of which are delivered between the bones of the back to numb the lower half of your body. These are commonly used during childbirth, bladder operations, and hip replacements. So that's probably what's going to be used for me for my bladder. But they use that for numbing agents, but I think they use something else just to put you to sleep. Not really in an incoherent, maybe it's not really an incoherent state of sleep, but it's in a sleep nonetheless. You may also be given a sedative which produces a relaxed, sleepy state that does not fully eliminate your awareness. Exactly like what I said. General anesthesia, in contrast, aims to do just that, creating an unresponsive drug-induced coma or controlled coma for that period. As Robert Sanders, an anesthesiast at the University of Wisconsin-Madison, puts it, we've apparently ablated this period of time from the person's experience. So when you wake up, you don't remember that part. You just remember that, oh, I had this and I'm recovering now, We still don't know exactly why anesthetic agents dim our consciousness, but they are thought to interfere with various brain chemicals called neurotransmitters. These chemicals turn up or turn down the activity of neurons, particularly the widespread communication between different brain regions. Well, I like that because I don't want to feel anything. Propofol, for instance, a milky white fluid used in general anesthetics and some types of sedation, seems to amplify the effects of GABA, an inhibitor that damps down activity in certain areas of the brain, as well as communication between them. These areas include the frontal and parietal regions, at the front and towards the back of the head. Sanders' colleagues recently used a form of non-invasive brain stimulation to demonstrate this principle in action, with propofol silencing the waves of activity you would normally see spreading across the brain in response to the stimulation. It is very possible that anesthesia interferes with the ascending transmission of information, he says. Without it, the mind temporarily disintegrates, becoming a blank screen with no ability to process or respond to the body's signal. And that's what we need during painful procedures and surgeries. In the clinic, there are many complicating factors to consider, of course. An anesthesiast may choose to use one drug to induce the temporary coma and another to maintain it, and they need to consider many factors, such as the patient's age and weight, whether they smoke or take drugs, the nature of their illness, to determine the doses. That's why you need someone who specializes in it. You can't just take any doctor and say, okay, knock this person out, let's go. You can't just say, okay, putting a gas mask on them and that's it, because the anesthesia could be the one that would kill you rather than just help you for the duration of your surgery or procedure. Many procedures also use muscle relaxants. For example, nearly half of general anesthetics administered in the UK included neuromuscular blockers. These drugs temporarily paralyze the body, preventing spasms and reflexes that could interfere with the surgery, without raising the dose of the anesthetic drugs to dangerously high levels. Yeah, because if you make the anesthetic too high, it could kill someone, because you need a high dose to stop movement, period. Because, like, even when people are in a coma, they can still twitch. It's just involuntary twitching, not twitching because they're awake or coherent or anything, you know. So yeah, I understand. So you just put them in a low state of coma, but then you add that the muscle relaxants, and it does the job, but you don't die. You don't end up dying or having repercussions. Neuromuscular blockers can also ease the insertion of a tube through the windpipe, which can be used to ensure the airway remains open, as well as to deliver oxygen and drugs, to prevent stomach acid from entering the lungs. If the paralytic agents also stop muscles in the diaphragm and abdomen from moving, however, the patient's breathing must be assisted artificially with a ventilator. Of course, if you have to stop things from moving, then you need a ventilator. Some surgeries need that if you're doing upper respiratory surgery, obviously. Oh yeah, and to prevent stomach acid from entering the lungs, of course, yeah. This all makes anesthesia so much art as science, and in the vast majority of cases, it works astonishingly well. More than 170 years after Morton's public demonstration, anesthesists across the world plunge millions of people each year into comas and then bring them out safely. This doesn't just reduce patients' immediate suffering. Many of the most invasive life-saving procedures would simply not be possible without good general anesthesia. But, as with any medical procedure, there can be complicating factors. Some people may have a naturally higher threshold for anesthesia, meaning that the drugs don't reduce the brain activity enough to dim the light of consciousness. Oh, that's true. So, maybe the doctor thinks that, okay, this dose should work for them, but then they can't predict 100% all the time if a certain dose is the right enough dose that will induce them into a coma, into a temporary coma, or a state of unconsciousness. Because maybe they're like, okay, we thought this was enough, but they needed this much, so they're conscious now, and we're sorry about it. Sometimes it happens. In some cases, such as injuries involving heavy bleeding, an anesthetist may be forced to use a lower dose of the anesthetic for the patient's own safety. Well, in that case, you might wake up from it, and it may not be something you want, but versus playing it safe, it's really difficult to say, to weigh in what you would better have. But I'd rather be safe, but I at the same time I don't want to wake up. It may also be difficult to time the effects of the different drugs to ensure that so-called induction dose, which gets you to sleep, doesn't fade before the maintenance dose to keep you unconscious kicks in. or they give you one dose, but then maybe later they give you, maybe you're like have an IV that's dripping doses and doses into you, and then you don't get the hit of the main dose until yeah. It's a whole lot of In some situations, you might be able to raise or lower your limb, or even speak, to show the anesthetic is not working before the surgeon picks up your scalpel. But if you have also been given neuromuscular blockers, that won't be possible. The unfortunate result is that a small proportion of people may lie awake for part or all of their surgery without any ability to signal their distress. 'Cause you want to say something, you want to be like, hey, I'm awake. But you can't because they gave you a muscle relaxant and you can't move a limb. But I mean, well, in my opinion, maybe I don't know what the time frame is for them to wait before they actually start, to actually be able to see if the anesthesia worked or not. So, Donna tells me about her own experience during a lengthy telephone conversation from her home in Canada. She says that she had felt anxious in the run-up to the operation, but she had general anesthetic before without any serious problems. She was wheeled into the operating theater, placed on the operating table, and received the first dose of anesthesia. She soon drifted off to sleep thinking, here I go. Well, of course, if you've done it once and you had no problem, you wouldn't be weary of the second time. But I guess she had a little bit of apprehension, which is like, oh well, I've done this before, it shouldn't be that bad. And it's you call it an operating theater because there's like a window on the top of the operating room that leads into another room where residents and interns can sit and watch operations happening. Those who want to see it, or those who that's their field of work and they have to like sit in on a certain number of operations and watch it happen before they can actually be in one, or they assist in some and have to watch some, have to do a little bit of both. When she woke up, she could hear the nurses buzzing around the table. She felt someone scrubbing her at her abdomen. Oh man, she felt things happening. Oh, that's the worst. I feel bad for her already. But she assumed that the operation was over and they were clearing up. I was thinking, oh boy, you were anxious for no reason. But it was only once she heard the surgeon asking the nurse for a scalpel that the truth suddenly dawned on her. The operation wasn't over. It hadn't even begun. Oh man, I feel so bad for her. It's so heart-wrenching to know that she was awake for all of it. All of it. The next thing she knew, she felt the blade of her knife against the belly as it made the first incision, leading to excruciating pain. She tried to sit up and to speak, but thanks to a neuromuscular blocker, her body was paralyzed. I felt so powerless. There was nothing I could do. I couldn't move, couldn't scream, couldn't open my eyes. She says, I tried to cry just to get tears rolling down my cheeks, thinking they would notice that something was going on, but I couldn't make tears. So the muscle relaxants, they stop your muscles from moving and your body from moving, but your conscience and your brain feels everything that's happening to you. Oh man, I thought that she was still numb everywhere. She was just awake to see things happen, but man, she felt it all. I feel so bad for her, and I don't wish that on anybody. The frustration was immense. It felt like someone was sitting on me and holding me down. There's absolutely nothing I could do. That's torture, like you're being medically something medical is happening to you against your will. That's just sad, even though it's not. even though it's not, it feels that way. Eventually, she tried to focus all her attention on moving one foot, which she managed to wiggle very slightly, and felt astonishing relief when one of the nurses placed her hand over it, before she could move it again. However, the nurse had let go. She tried a total of 3 times, all with the same result. It was very frustrating for me knowing that was the only way to communicate and it wasn't working. Well, of course, the nurse didn't think anything of it. She said, oh, maybe the muscle relaxant is wearing away and stuff like that, so they just held it, you know. They didn't really think seriously of it. Donna's torment should have finished after the surgeon had ended his work, but as the neuromuscular blockers began to wear off, she started to move her tongue around the tube stuck down her throat. It was a way, she thought, of signaling to the staff that she was awake. Unfortunately, the staff misread her attempts at communication and began to withdraw the tube prematurely, before the paralytic agent had faded enough for her lungs to be able to operate on their own. So here I was lying on the table, and he took away my life support, my oxygen. I could not take a breath, Donna says. She assumed she would die. Ah, and me having asthma, I feel that once in a blue moon, but excruciating. It's just terrible pain. I need to run to my doctor and be like, help me. But I'm lucky that I haven't ended up in the emergency room because of that, because my rescue inhalers thankfully are doing the job. But when you feel it, you have to run to your rescue inhaler. Oh, you know, I can understand. This must have felt 10 times worse. At this point, the operating room began to feel more distant, as she felt her mind escape in and out of body experience. A committed Christian, she says she felt the presence of God with her. It was only after the staff restored her oxygen supply that she drifted back into the operating room to wake, crying. Of course, now she woke up and she's crying, and then now she told them what happened. They're like, oh my goodness! But of course, the doctors, I think sometimes the doctors won't believe you, but they'll believe you too, so it's like, oh man. The pain, the fear, the sense of absolute helplessness all still linger to this day. Feelings of trauma that have led her to be put on medical leave from her job, and that has meant a loss of independence and confidence, and the abandonment of many of the hopes and dreams that she had built with her husband. It's hard to sit at home here and watch all the neighbors hurrying out of their house in the morning, jump in their cars and go off to work, and I can't. Of course, because now you have panic and trauma, panic attacks, trauma, anxiety, and you don't want to, like, be driving and have one, and it's terrible. I've had a panic attack before, and lucky, I was crying, but lucky for me, I was on my way to some store, and I made it into the parking lot, and I just parked my car and sat there and finished crying, and then I went and did my shopping and then came out again, and I was, like, pretty much okay to drive home. Various projects around the world have attempted to document experiences like Donna's, but the Anesthesia Awareness Registry at the University of Washington, Seattle offers some of the most detailed analysis. Founded in 2007, it has now collected more than 340 reports, most from North America, and although these reports are confidential, some details have been published and they are making illuminating reading. Well, because they have to study this to figure out why it happens and all the things so they can fix it and get better at it, you know? And get better, yeah. Nearly all the patients included said they heard voices or other sounds under general anesthesia. Patients' eyes are typically closed during surgery, so visual experiences tend to be less common. Oh, okay, so your eyes don't, if the anesthesia wears off, your eyes don't open because the muscle relaxants prevent you from moving your eye muscles to, like, wake up. So your eyes are still, like, closed, but you can hear and feel things, and the hearing things is not as bad as the feeling the things. And that's what scares me the most about going to surgery, is about feeling the things, you know. I bet I want to ask 1,000 questions about that when I have to do some sort of procedure. I'm probably, that's gonna be probably my #1 issue. I'm gonna be like bringing it up like a million times, like, am I gonna be awake? Am I gonna feel this? Oh, I mean, like, not am I gonna be awake, like, is the anesthesia gonna keep me asleep forever until you guys are done, or am I gonna wake up from it? I've read stories, oh my gosh, you know, and that's just traumatic enough for me. I heard the type of music and tried to figure why my surgeon chose that. One patient told the registry, several voices around me. They seemed to be panicking. Heard them saying they were losing me. Another reported, sting and burning sensations of 4 incisions being made like a sharp knife cutting a finger, wrote one. Then searing, unbearable pain. Of course, you can't move to tell them you're awake and you feel everything. It's like you're being tortured by someone who shouldn't be torturing you. That's how it feels, and you don't even think about, like, oh man, this is supposed to be life-saving treatment for me, but that's not what you're thinking about at the time. It's like, oh, someone's torturing me and putting me under all this. Oh no, I want out, you know? There were 2 parts I remember quite clearly, wrote a patient who had had a wide hole made in his femur. I heard the drill, felt the pain, and felt the vibration all the way up to my hip. The next part was the movement of my leg and the pounding of the nail. The pain, he said, unlike anything I thought possible. Well, if they're doing their job properly, of course, they've done this a million times, they're not going to make a mistake, but you're not supposed to feel what they're doing. You feel it when you hear it. It's going to cause you trauma after surgery. It is the paralyzing effects of the muscle blockers that many find most distressing, however. For one thing, it produces the sensations that you are not breathing, which one patient described as too horrible to endure. Oh, so the muscle relaxants cause you to stop breathing because they shut your whole body down from movement. And that it feels you're constrained, like, that's why they have the breathing tube. So, oh man, once the breathing tube stops, oh man, worst nightmare. Now I'm gonna have to be like, muscle relaxants. Just have someone hold me down, please. I'll have to feel, but then you don't want your tongue to move with the whole contraption in there because of that too. So it's a toss-up. To make matters worse, all of the panic can be compounded by lack of understanding. Oh. There's the helplessness, another patient noted. Screaming in my head, things like, don't they know I'm awake? Open your eyes to signal them. Yeah, the muscle relaxants prevent your eyes from opening. Yeah, it's true. To make matters worse, all of this panic can be compounded by a lack of understanding of why they are awake but unable to move. They have no reference point to say why is this happening. This is Christopher Kent at the University of Washington, who co-authored the paper about these accounts. The result, he says, is that many patients come to fear that they are dying. Those are the worst of the anesthesia experiences. Yeah, well, I think that's what everybody feels. Estimates of how often anesthesia awareness happens have varied depending on the methods used, but those relying on patient reports have tended to suggest it was very rare indeed. It's rare, but still happens, and it's still scary, no matter how rare. One of the largest and most thorough investigations was the 5th National Audit Project carried out by the British and Irish Anesthesiasts Association. In each and every public hospital in the UK and Ireland had to report any incidents of awareness for a year. The results, published in 2014, found that the overall prevalence was just 1 in 19,000 patients undergoing anesthesia. The figure was higher, around 1 in 8,000, if the anesthesia included paralyzing drugs, which is to be expected, since they prevent the patient from alerting the anesthetist that there is a problem before it is too late. Maybe I'm going to ask about that if I really need it. Be like, can I not have it so I can alert you if I'm awake? Please, to save my life. These low numbers were comforting news. As the media reported at the time, you were more likely to die during surgery than to awake during it, confirming many doctors' suspicions that this was a very remote risk. I know, but it's still scary for people when they think about it. Unfortunately, these figures are probably underestimates, as Peter Oder explains to me at St. George's Hospital in London. For one thing, the National Audit Project relied on patients themselves reporting directly to the hospital, but many people may feel unable or unwilling to come forward and would instead prefer to just put the experience behind them. Oh no, I would report to my doctor. I would say, can I report further on? Give me the directive. I'm reporting this. Because I want it known. I want the books to be heard. I want the people to hear my story and make a note in their books as another statistic. You know, if it happened to me, I pray to God that it doesn't happen to me. Dear Lord, if I ever have to go under anesthesia of any sort, please, where I'm put to sleep, please, don't make me wake up on the surgery room. Amen. There are also the amnesia effects of the drugs themselves. Anesthetic drugs disrupt your ability to encode a memory, says Oder, and the dose that you give to obliterate memories is lower than that you need to obliterate consciousness. So memory goes well before consciousness goes. I guess the memory part is good because you don't remember all the work they did, but I mean, you were conscious, so you felt the pain. I guess you can remember that part. I don't really know exactly. The result is that many more people might be conscious during surgery, but they simply can't remember it afterwards. Oh, they were conscious and they felt the pain, but then after, they can't remember it afterwards, but then I guess somewhere trauma gets triggered for some reason or another. I don't understand that part. I don't understand how you get traumatized for it if you can't remember it afterwards. Maybe you just know that you're traumatized, you don't know why, but then people tell their story, so, you know, maybe they remember that they were at work during surgery, but they don't remember what happened in surgery. Oh, okay. Okay, fair enough. To investigate this phenomenon, researchers are using what they call the isolated forearm technique. During the induction of the anesthesia, the staff place a cuff around the patient's upper arm that delays the passage of the neuromuscular agent through the arm. That means that for a brief period, the patient is still able to move their hand. Some member of staff could ask them to squeeze their hand in response to two questions: whether they were still aware, and if so, whether they felt any pain. Oh, I want that. I want that 100%. I am going to say, doctor, please keep what you don't need. Keep what you don't need working so I can signal to you if I'm in this. The rest of my life. Oh, yeah. Just numb my body. Probably you have to numb my legs to get in the... Yeah, I said just numb my legs so I can't move them, but my arms, keep them working. In the largest study of this kind of date, Robert Sanders, the University of Wisconsin-Madison, recently collaborated with colleagues at 6 hospitals in the U.S., Europe, and New Zealand. Of the 260 patients studied, 4.6% responded to the experimenter's first question about awareness. Boy. This is hundreds of times greater than the rate of remembered awareness events that had been noted in the National Audit Project, and around 4 in 10 of those patients who did respond with the hand squeeze, 1.9% across the whole group, also reported feeling pain in the experimenter's second question. Oh boy, now that's scary. Well, for me. These results raise some ethical quandaries. Whenever I talk to the trainees, I talk about the philosophical element to this, says Sanders. The patient doesn't remember. Is it concerning? Well, that's really a tough question to answer. Sanders says that there's no evidence that the patients who respond during the isolated forearm experiments but fail to remember the experience later do go into the developed PTSD or other psychological issues like Donna. And without those long-term consequences, you might conclude the momentary awareness is unfortunate but unalarming. Oh, so they're like, you're not supposed to remember it after, so that's fine. You just go on with life. But they're surprised to learn that it can still cause people like Donna PTSD. And that's something that needs a lot more study to figure out the hows and the whys. And it's unfortunate, but it's not but it's not alarming. Obviously, I guess, Yet the study does make him uneasy, and so he conducted a survey to gather the public's view on the matter. Well, of course it would make someone uneasy because it happens and they have to face the facts and try to do something about it. Opinions are mixed. Most people didn't think that amnesia alone is sufficient, but a surprisingly large minority thought that as long as you didn't remember the event, it's okay, Sanders says. I mean, it's great that you don't remember it, but at the moment you're there feeling all the pain, oh, that moment is the worst for someone, I mean, and then you can go on to say, well, you don't remember it now. Now you've recovered, you don't remember it anymore. Yeah, but at that time I did remember it and I was under pain. That has to count for something, You're just not supposed to feel the work they're doing on you, Yet the study does make... my view is that the patient is expecting to be unconscious, and as a researcher who wants to understand the mechanisms at play, but also a clinician who wants to deliver high-quality care and meet the expectation of the patient, we are duty-bound to understand this balance and to find out the true rates, the true impact of these events, whether they have any impact or not, and the ways we can curtail them. Yay! We want this to be figured out so future surgeries will be better. Given the vast majority of patients will emerge from general anesthesia without traumatic memories, there is in the worst case scenario. These fears could even prevent someone from having an essential medical procedure. Certainly anesthesists such as Sanders have emphasized that the risks of explicit recall are small, but if you are anxious, you should talk to the hospital staff about your concerns. Of course I will. Number one, of course I will. But there are, nevertheless, strong arguments for making the phenomenon more widely known. For instance, as the reports from the University of Washington's registry show, some patients' distress were amplified by their lack of understanding of what was happening. They assumed that their awareness was a sign that they were dying. Perhaps if they had known the risk beforehand, the panic might have been assuaged. Well, I know now, so maybe I won't panic. It's like, even if you know from beforehand, some people still panic at the moment. Even if they know what the procedure is, even if they know the everything, people still panic, and that's what causes all this issues. I mean, I don't know if it will be any better if you know it beforehand. For some people, probably would. For me, I can't tell you at this point. A better understanding of anesthesia awareness might also help medical staff to deal with patients who have experienced this trauma. Many, including Donna, have felt that their accounts were misunderstood or simply dismissed by medical professionals. Yeah, if they try to understand it and try to help these people, things can get better. The Washington Registry, for instance, found that 75% of those who had reported awareness were unsatisfied with the response. 51% saying that neither the anesthetist nor the surgeon expressed sympathy for their experience. Overall, just 10% received an apology and only 15% were referred for counseling to help them to deal with the trauma. I would go seek the counseling myself! Forget anybody referring me! But yeah, you want the doctors to say something, to acknowledge that this happened to you and do something about it for the future, Donna says that many of the staff at her hospital seemed completely bewildered by her trauma. As she came around, she tried to explain to the nurses what had happened to her, but they just stood in silence. She says, "I'll never forget their expressions. It was like they were in shock." She puts this down to a lack of education and understanding of the phenomenon. They didn't know how to handle this kind of situation. Of course, because you're never trained that someone's going to wake up from this and experience X, Y, and Z, And then you're just like, oh, really? It happened to you? Oh my gosh, and they don't know how else to comfort the patient. Having gained strength in the years following the trauma, Donna is now trying to remedy the problem by working with Canadian universities to educate doctors about the risks of anesthesia awareness and the best ways to treat patients. I want them to be prepared, because when things go wrong, you need to know how you are going to react to the patient, because that is crucial to the patient's recovery process. Exactly. If they tell you this happened, you can be comforting and feel their pain and stuff like that, and then be aware that it happened to them. Just, show some sympathy. And that's really all they need, because there's not much you can do. You can say, well, and then you can try to analyze, let's say, this is what we did, this is what we should have done. And then you make a note of that for future references for the next people you operate, or maybe she won't want to do anything anymore, but if it's serious and she really needs it, oh Lord. The ultimate goal, though, is to prevent those traumatic experiences from occurring in the first place, with studies using the isolated forearm technique helping to identify the best procedures to ensure unconsciousness. There could be specific combinations of drugs that could produce the right blend of anesthesia to insulate people from the external sensory world a bit better, Sandra says. Yeah, it just takes trial and error, but the trial part is the worst. There's even a chance that, as our understanding of the anesthetized state deepens, we might be able to turn rudimentary unconscious responsiveness during surgery to our advantage. Certain forms of medical hypnosis have been found to have a real effect on patients' experiences in controlled clinical trials, and the anesthetic state could be the perfect time to put it into practice. Oh, hypnosis! To actually see if they're awake or not, and they respond before you put the muscle relaxants in. Sometimes it's not necessary. Sometimes it's not even necessary, but anyway. Although widespread, signaling across the brain appears to be impaired when people are under general anesthesia, there is evidence that certain areas, including the auditory cortex, remains responsive, suggesting that medical staff might be able to send suggestions and encouragement while the patient is unconscious to reduce their pain after surgery. Yeah, that's probably all they need. They need to feel, they need to feel it. Studies investigating this possibility are few, but Jenny Rosendahl at Jena University Hospital in Germany and colleagues have attempted to gather all the evidence to date. Their meta-analysis showed a small but significant improvement in the patient's ratings of post-operative nausea and vomiting, and less use of morphine after the operation. Clearly, no one is suggesting that you would keep a patient fully aware on purpose, but perhaps one day more anesthetists will be able to make use of the brain's ability to absorb information on the operating table. It is an exciting thought that the words we hear during the mysterious twilight zone could have a lasting effect on our recovery. Of course, you can physically recover, but mentally, you could just be out of it. And physically you could be out of it, but mentally you're still there, and that's the worst. And hopefully that they can figure it out and reduce the number to like 1 in a million, but it's all a work in progress and a lot of trial and error, but it's hard. In my case, I probably don't want whole body muscle relaxants if I don't need it, you know, so that I can signal for help when I'm like in distress, like you know. Anyway, I guess you have to relax like this if you have like a breathing tube, but you know, it's like, anyway, hope to figure it out and the surgery doesn't become this scary ever again. Anyway, that's traumatizing. Anyway, thank you for watching this video, and click like and subscribe to my channel, and check out my other videos, and check all my links down below, my social media and my pages where I'm selling stuff. Maybe you'll find stuff that you would like to purchase for gifts or for yourself. And check out Stefanie's links to her social media and stuff that she's posted and selling too. And for me, I have some clothes and various items that I'm selling, and I also have makeup if you check out my Facebook live video that I'm selling, so check it out there. I'm very generous when it comes to pricing. Talk to you later. I'm out.